Good morning and thanks for joining us. I'm Eliza Navarro. As COVID-19 continues to spread across the Lone Star State, inconsistent data results prompted the state to begin an investigation. So where does Texas stand? Teresa Woodward has the details.
Contain the coronavirus.
Watch this from April 17th.
Now, in opening Texas, we must be guided by data and by doctors.
Governor Greg Abbott tied Texas's COVID recovery to COVID data about cases, hospital capacity, and testing. In particular, the percent of COVID tests coming back positive. As the governor announced a round of business reopenings May 5th,
more than 95% of the people who were tested test negative.
he touted a positivity rate of around 5%. It steadily increased through June, leveling off in mid-July. And then, starting August 1st, it spiked fast, reaching a record 24.5% Wednesday, before dropping to 16% the last 2 days. Thursday, the governor announced the state was investigating.
They brought in a data team to dig deep into it to find out exactly what the reason is for the increase in the positivity rate.
The Department of State Health Services now says a computer update on August 1st resulted in a backlog of positive tests, making it into the tracking system. They also fixed coding errors from 2 labs, so positives from those sites suddenly got counted too. What does it mean? The positivity rate has been inaccurate for at least 2 weeks.
I think, there's not going to be perfect data.
Dallas County's Director of Health and Human Services says reliable data is critically important to tracking spread, but it's difficult to collect clean data with so many cases.
We are still dealing with paper faxes of lab data and lab reports, hundreds of those a day that we're having to deal with.
It's a reminder, he says, you can't rely on just one data point. COVID is still spreading. Texas is not in the clear. In Dallas, I'm Teresa Woodward.